So, good morning to everybody. I'm absolutely happy to greet all of you today here in sunny Ulaanbaatar. We have made quite a trip to come here and would like to share our knowledge with all of you, all about PCR, all about infections. And really, we shall start with infections, which are still very important in 21st century. Why? What difference we can observe in infections in 21st century? The core postulates do not work any longer because in many cases we are dealing with mixed infections instead of monoinfections. It means that the pathogenesis mechanisms of many of those infections are still unclear. And it's really difficult to determine all infectious agents in these mixed microbial populations. What is more important is that we observe low efficacy of antimicrobials in vivo despite their positive results in the tests. It means that antimicrobial treatment is not that effective as it was before. And you can see at this slide that the role of opportunistic microorganisms becomes greater in 21st century. And this is the example of urinary tract infections. Even in case of uncomplicated urinary tract infections, 1/4 of all cases are associated with opportunistic microorganisms and not Escherichia coli. And if we shall speak about complicated cases of urinary tract infections like pyelonephritis or urosepsis, then more than half of all cases will be caused by different opportunistic microorganisms. And here you can see the most popular and the most important opportunistic bacteria, which usually cause different infections in different anatomical niches of our organism. But what about the diagnostics? Cultures are time consuming. Because cultures require at least 48 hours for the primary growth, and then a few more days to perform antibiotic testing and to define the exact species. Also, cultures are labor consuming and they are costly. And they are insufficient when we are speaking about the polymicrobial communities. Why? Because some bacteria are growing faster than the others, and they will mask other also important bacteria in the community. And another problem is the difficulties in the decentralized sampling. Mongolia is huge, like Russian Federation as well. And if you want to perform decentralized sampling and to bring those samples to the laboratory, most probably some of bacteria will die during the storage and the transportation. No, it does not work. You see something with my clicker? Oh, excuse me. And so, I would like to introduce you the Backscreen OM kit. It's the real-time PCR kit which was designed for detecting of 25 opportunistic bacteria. And 7 of them belong to gram-positive bacteria, and you can see the most important representatives of gram-positive bacteria like Streptococcus species with the pathogenic Streptococcus pyogenes, Streptococcus pneumonia, and Streptococcus agalactia, Staphylococcus species with Staphylococcus aureus and Enterococcus. And also 18 groups of gram-negative bacteria. The majority of them belong to to Enterobacterialis genera, and all of them are important in different opportunistic infections. Also, we can detect Pseudomonas aeruginosa, Haemophilus species with Haemophilus influenza, Burkharderia, and some others. Now let's have a look at the example of lab report automatically generated by special software after the PCR run is over. First of all, we can detect the total number of bacteria in the sample. It's very important because you can understand how many of them were. Then we can see how many bacteria were positive in the test. And the test has the built-in logical controls. Like when you detect Streptococcus agalactia, you will have also positive test for Streptococcus species. The same is true for Staphylococcus. When Staphylococcus aureus is positive, Staphylococcus species also has to be positive. Also for Enterobacterialis, you see the same way. And in this sample, also Acinetobacter, Haemophilus were detected. So I shall come back for a few seconds. You can see that all these bacteria were detected quantitatively. What is more important, that their proportion compared to total bacterial load was calculated. It means you can understand who is the first in this company. So who is the leader. But what is also very important, you know who else is present here. And in case, for example, when antimicrobials will be effective against the leader in this microbial company, then maybe some other representatives of this microbial community will also play some important role in the infection. And the doctors will have to change the antimicrobial treatment, and they will choose the appropriate drug. What are the recommendations for the diagnosis? You can see that a wide range of medical specialists can use these tests. General practitioners, internists, urologists, gynecologists, neonatologists, and so on. And this test could be used for the outpatient population and also for inpatient care too. Then what about the biomaterials? Also, a broad spectrum of human biological materials are validated for this test. It's very important because we can analyze different swabs and scrapings of urogenital tract, gastrointestinal tract, and so on. We can analyze urine, semen, prostate secret, and so on. And what is very important, that we can analyze bacterial cultures as well. So, this test is fast because the time from the sample to result is not more than 4 hours. It's reliable with its high analytical sensitivity. It's complete because it allows us to detect all microorganisms, including non-culturable and fastidious. It is safe because in case you are working at the PCR laboratory, no need to work with live bacteria. And it is validated for a wide range of biomaterial. Now, the other serious issue facing the mankind in 21st century is the antibiotic resistance. All of us know that antibiotics save lives. But in the middle of the 20th century, when they were discovered firstly, it was the golden era of antibiotics. And both antibiotics and vaccines dramatically changed the mortality structure, for example, at the beginning of 20th and at the beginning of 21st century. The difference is enormous. And also the increased human life expectancy. But the microorganisms are not sleeping. And each new antibiotic drug was met with antibiotic resistance just maybe in 1 or 2 years. And for example, methicillin, which was discovered in 1960, was met with resistance in 1962, just 2 years. So, and what about diagnostics? All methods of diagnostics for antibiotic resistance could be divided in two groups, the phenotypical and genotypical methods. The phenotypical methods we know for a long time, but they are also time-consuming. They need their period of initial growth as well. And sometimes they can give us false negative and false positive results. And sometimes the real clinical efficacy is different from the tests we detected at the laboratory. Genotypic methods are absolutely different because they allow us to determine the genes of resistance. What is it? And also we can determine the silent genes which could not be detected phenotypically. And so the panel of BAC resistor was designed for the detecting of genes of resistance, and it was called BAC resistor GLA and BAC resistor GLA 1 MEG. These two tests are very important in clinical usage nowadays because they can help us to determine the genes of resistance to gram-positive bacteria is BAC resistor GLA 1 MEG, and to genes of resistance to penicillins, cephalosporins, glycopeptides of gram-positive and gram-negative microorganisms. And again, what is very important, that different biological materials could be analyzed, including bacterial cultures. For example, in case you are working at the bacteriological laboratory, you can use these tests in combination with cultures, but also you can analyze just the test entering the laboratory at the first maybe day of hospitalization of the patients. And in some hospitals in Russia, we use this opportunity of this test, and the drug treatment, the antimicrobial treatment will be different from the first days of hospitalization. Now I would like to show you the examples of lab report. They are also automatically generated, and what is really good that they have the conclusions. For example, in the first in the test on the left is the example of BAC resistor GLA. You can see that some genes were detected. And the conclusion gives us that beta-lactam antibiotic resistance genes are found, and the manifestations of resistance to penicillins, cephalosporins, or monobactams in gram-negative bacteria are possible. So it's very clear to medical specialists. And also different groups of medical specialists for different patients could use these tests because it's fast, it's robust, and it allows to get very quick results in order to guide optimal therapy of our patients. The test also allow us to get the results just in 4 hours. And it will detect all resistant bacteria, not only those that have the phenotypical presentation of resistance, but also the bacteria with silent genes. And it will also detect resistance in fastidious and non-culturable and difficult to culture bacteria, and it's validated for a wide range of biomaterial. What is very important that we can combine it with different other tests. The line of BAC resistor was designed in combination with BAC screen test, and we can use them together. What is more interesting, we can also use this test in combination with femafluor test and androfluor test, for example, when facultative anaerobes, gram-positive or gram-negative, were determined by those tests. And also we can use them together with cultures at the bacteriological laboratory. And now the next part of my speech will be about mycosis and detection of yeast fungi, because the unrestricted usage of antimicrobial drugs brought us another problem, the wide spread of different mycoses. And we are especially thinking about the mycosis caused by opportunistic fungi, and yeast-like fungi are very important when we speak about them. Those yeast-like fungi belong to species of Candida, Malassezia, and Saccharomyces. They could cause both superficial and invasive mycosis. But in case of superficial mycosis, the diagnosis is quite clear because it usually made upon the clinical presentation. Here you can see the examples of vulvovaginal candidiasis and candidiasis in a newborn baby. But when we speak about the invasive candidiasis, the situation is much more complicated because clinical presentation is unclear, and you can easily think about bacterial infection. And for example, if you will give a few antimicrobial, antibacterial drugs to a patient with invasive mycosis, most probably you will worsen its condition. And you can see that there are many clinical forms in invasive mycosis, and without laboratory diagnosis, we can't get the precise diagnosis for those patients. So, again, what about laboratory diagnosis? For many years, the gold standard for diagnosis of fungi were cultures and microscopy. But both methods have their limitations. Microscopy will give us information only about the morphology of fungi, but we can't detect the precise species of these fungi. As for cultures, usually it's a very time-consuming method because they are growing for days and sometimes weeks, and we just do not have this time to perform the diagnostics. As for serological tests, they are useless in case of mucosal infections. And that's why we're again speaking about a molecular-based technique. And mucosal screen is a novel test, which I also would like to introduce to you, to those who never use this test, because this test is really a game changer in diagnosing of fungi infections. Here you can see that we can accurately diagnose 14 different species of fungi from 4 the most important groups. And why is it so important? Because different fungi species react differently to antifungal drugs. And it means that we have to know the precise species causing the infection in order to find the most effective treatment for the patient. And we can use mucosal screen for different populations of our patients. First of all, for the diagnosis. In case you suspect candidiasis, candiduria, or maybe Candida carastate, you may use this test. Also, we can use it for the monitoring and to track fungal colonization in non-sterile body sites or lesions and catheters. And we can use it for all groups of patients. And what is also important, that we can use this test also in combination with cultures in order to confirm the positive fungal cultures. And we can recommend it also to a wide range of medical specialists and to different patients. Very important to use this test for the immunocompromised patients, for premature babies, for oncology patients, those who are very susceptible to this kind of infections. And what about the biomaterial? Again, a wide range of biomaterial could be analyzed by this test, including sputum, urine, blood, different swabs, and also fungal cultures. And now I would like to show you the example laboratory report of mucosa screen test. It was the skin scrapings of the HIV positive child with dermatitis. And this test was part of our research we conducted together with our dermatologists at the university. Now let's have a look at the report. You can see that 5 different fungi species were detected in this sample. And we can see that the most prevalent, the predominant, were the Baromyces hanzeni and Malassezia. It was very important for our dermatologists because before this research, they were absolutely sure that the majority of the cases of dermatitis in HIV-positive children are caused by different bacteria. And this slide shows that not just single fungi is important for this type of dermatitis. And what is more important, that different fungi were found in HIV positive and HIV negative children with dermatitis. For children HIV negative, they are green. Malassezia, Candida fumata were the most important species. While for HIV positive children, Saccharomyces cerevisiae, Candida parapsilosis, Candida krusei, Candida albicans were the most prevalent species we detected in the samples. So the mucosa screen advantage are very clear because we can determine the wide range of fungal pathogens, and we can identify the true etiology of the infectious process. With this information, we can choose the precise treatment for our patients. We can choose antifungals, and what is very important again, that we can analyze practically every biological material obtained from human body. So that's all for my first speech. Thank you very much.